Do you struggle with daily back pain or just feeling like your core is not as strong as it used to be? Well, a lot of things happen in our bodies, especially as a woman over 40, and with hormones shifting, daily habits changing, just postural changes over time. It's inevitable that a lot of women are experiencing back pain and just feeling like their core is not strong enough like it used to be. Well, if you haven't tried Pilates exercise, it's one of the best ways to really rehab that midsection of your body, help your back pain, improve your posture, help you stand taller, and just take a lot of stress off the joints in your spine. And done correctly, Pilates-based exercise can be very therapeutic. It can help your back pain. It can really make your whole body just feel a lot stronger and more stable, especially with that carryover into your daily life or even athletic activities. So today I'm going to talk you through all the benefits of Pilates, how it can help lower back pain and help build your core strength, especially as a woman over 40. Now, your back changes, your spine changes over time, and if you are over 40, your discs start to dry out. You start to get more dehydration, lack of flexibility, just loss of overall mobility and strength. So not only that muscle strength starts to lessen and you have changes in your bone density and your muscle tone, there are things you have to work a little bit harder over time to be able to help that part of your body and really support your spine. So doing Pilates-based exercise is going to focus on really connecting your brain to your muscles and the muscles that we don't always think about using in regards to your breathing muscles, your pelvic floor muscles, the muscles at the bottom that support your pelvis, support your hips and your lower back, and even your diaphragm muscles. So with the breathing, that can work in sync with your pelvic floor and help support your midsection with what's really made up of your core, your abs, your lower back, stabilizing muscles, your pelvic floor, and your diaphragm. So that whole area needs to work together. And doing Pilates exercise, if it's taught in a more therapeutic manner, you are going to address that whole system and how it's going to support your back in a better way. With daily habits, it changes over time. We often spend a lot of time at the computer, at a desk, in the car, and that sitting can also put a lot of compression on your spine. So with Pilates exercise, you're going to work on more that elongation and helping take stress off the joints in your back and creating a lot more support around your vertebrae, those bones in your spine. And so having more support around your back by getting those muscles stronger and more capable to hold you upright, then that will affect your posture and you won't put as much strain and stress on your discs and on your joints around your lower back. So as getting toward perimenopause and menopause and beyond, over 40, with those hormone changes, it is also affecting your muscle tone, your joint stability, and therefore you have to work a little bit harder to add more protein into your diet and also build more muscle by lifting the things that are a little bit heavier and addressing those muscles that support your spine, so therefore things don't break down as much. So Pilates does target this core area and your back. It's going to work on that whole system, like I mentioned, with your pelvic floor, your diaphragm, your deep abs, and your multifidus muscles, which are those stabilizing muscles that attach to your spine. And so therefore, those muscles are going to be able to help your posture and help you feel stronger and more supported. So unlike just planks or crunches and traditional ab type exercise, Pilates is going to train those muscles of the deep core. Those muscles also affect bladder function. They support your pelvic muscles as a woman, so preventing things like prolapse, also helping support your back with less back pain, and creating better breathing, which also helps your lung function, your digestive system, and really your whole body will feel stronger and more stable when you're doing more athletic activities, because the midsection of your body is going to transfer into allowing your legs and your arms to move more freely and feel more powerful, especially things like golf or pickleball, or just going for a walk, going up hills or down hills. You're going to feel a lot more power and stability when you're doing those activities. So I'm going to demonstrate just a couple simple Pilates-based exercises, and these exercises are meant to be Pilates exercises on the mat. So at home, there's also Pilates Reformer, which I have in my studio behind me, which can be a lot of fun because it adds resistance to it, and you can do privates or classes. And in a more therapeutic environment with physical therapists, it's going to be able to teach you ways to help relieve your back pain and help you feel better. So some basic core exercises using Pilates mat exercises. You can do it without any equipment. Now, we're going to start on our back, and we're going to focus on just breathing first. So let's take your hands around your midsection and just place them on your lower belly. Think of taking an inhale through your nose and exhale through your mouth. When you do this about 5 times, you're going to feel your belly rise and fall. So you want to get that air all the way down into your lower belly instead of breathing here from the neck and shoulders and up in the chest. So as we take a deep breath in and out, you may notice that it's really hard for you to breathe from this area of your body. You may hold a lot of that tension up here, and this is something really great to practice because it'll also help release the lower back muscles and just create a more calming effect and helps your nervous system, which also plays into having back pain. So practicing some deep breathing exercises and making sure that you're not just breathing with your ribs, but you're breathing down into your belly. So belly breathing and allowing that area in your lower back. You can even put your legs up like on a wall or a box or a chair to take a little extra stress off of your back as well. So starting with some breathing exercises. The next thing that you can do, we're just going to do some gentle rocking of our hips. So think of this like a pelvic tilt. And if you imagine your pubic bone lifting up and then tipping it down and forward, creating a little space between the back and the mat, we're just going to rock back and forth about 5 times. And here you can see we're just creating a little movement in our spine. If this hurts, then just go back to the breathing. Don't do a lot of movement there, but we're having to move our spine throughout the day. So this is something that we want to get used to. Then next, we're going to try a bridge. So we're going to take that big inhale, and then as you exhale, you're going to pull those muscles in. So think of your navel pulling in toward your spine, and we're going to lift our bottoms off the floor. So we're coming up to a bridge, and we're pulling in those muscles through your core. Make sure you're not holding your breath. You want to inhale first to start, and then exhale, draw in those muscles. Think of pulling the hips together and then lifting your bottom up off the floor. So that's a bridge exercise, and you can repeat that about 5 to 10 times. But just starting with some basic Pilates mat exercises, and then therefore going into a further longer series of exercises that are going to focus on this area of your body. All right, that's just a small sample of what we can do in a full Pilates exercise video. Think of 20 minutes a day that can really change your life, making you feel more confident in your body and help you finally get over this back pain. So guided by myself as a physical therapist, I am launching a program. I'm gonna put the link below to get on the wait list so you can get access first and special discounts for the ones that get on the wait list first. You can get access to Pilates-based full videos where it's going to take you through a program that's going to help your back pain, help your core feel stronger, just make you feel more confident, and also bonus, solving bladder problems, helping prevent any pelvic floor issues as we get older. Now, so Pilates, I rave about it because I've seen it work for so many clients over the last 20 years in my career as a physical therapist. And it is amazing if you just stay consistent over time. So think about 15-20 minutes a day of a routine that you do. You can go back and watch other Pilates-based videos also on this channel. So I hope you enjoyed this and got something out of it, understood more how Pilates can be beneficial for you and your back pain and building your core strength, especially as you're a woman over 40. So thanks for watching. Hit subscribe if you haven't already, and we'll see you again in another video.